Ansari, and my roll number is PP1650111, and the topic for my presentation is drug codeine. Codeine is an opioid analgesic. Opioid analgesics are substances that act on opioid receptors to produce morphine-like effect. They are used for pain relief. So codeine belongs to this class and is used to decrease pain by increasing the threshold for pain without impairing consciousness or altering other sensory functions. So basically, codeine is utilized as central analgesic, sedative, hypnotic, antidepressive, antiparasitic agent, and is sometimes recommended in certain diseases like coughing. Mechanism of action. Codeine is a selective agonist for the M2 opioid receptor, but with a much weaker affinity to this receptor than morphine, as morphine is a more potent opioid drug. Codeine binds to mu opioid receptors, which are involved in the transmission of pain throughout the body and central nervous system. The analgesic properties of codeine are thought to arise from its conversion to morphine, although the exact mechanism of analgesic action is unknown at this time. Target action. So the drug codeine targets mu type opioid receptor, kappa type opioid receptor, and delta type opioid receptor and produces agonist-like effect. There are various side effects that are associated with the use of codeine. Some common side effects include vomiting, constipation, itchiness, lightheadedness, and drowsiness. And some serious side effects that are associated with the use of codeine includes breathing difficulties and addiction. There are various forms and strengths available in adults. Codeine alone or in combination with medications comes as tablet, a capsule, and a solution that can be taken by mouth. Tablet, we have 15 mg, 30 mg, and 60 mg. Oral solution is available as 30 mg per ml, has not been available for over 1 year. The FDA has recommended that codeine not to be used in children less than 12 years and all pediatric patients undergoing tonsillectomy and adenoidectomy. Pain off label. Greater than 12 years, contraindicated. Less than 12 years, we can have 0.5 to 1 mg per kg per oral every 4 to 6 hours PRN, and not to exceed 60 mg per dose, titrate dose to pain relief. Use lowest effective dose for shortest period of time, as we know that it has various side effects. Alternatively, we can use 15 to 60 mg per oral every 4 to 6 hour PRN and not to exceed 360 mg per day in naive patients. Cough off label. Greater than 12 years, not recommended. 12 years, we can have 7.5 to 30 mg per oral every 4 to 6 hour PRN. Dosage forms and strength in pediatric patients. We have 15 mg, 30 mg, and 60 mg tablet. Pain, we can have 15 to 60 mg per oral every 4 to 6 hours PRN and not to exceed 360 mg per day in 8 days patients. Cough off label, we can have 7.5 to 30 mg per oral every 4 to 6 hours PRN. Drug infections. The drug codeine interacts with various drugs, with abacavir, benznidazole. Codeine may decrease the excretion rate of which could result in higher serum levels. With amlomalatin, camazepam, the risk of severity of adverse effects can be increased. With cannabinoic acid, it may increase the excretion rate of codeine, which could result in a lower serum level and potentially a reduction in efficacy. Levofloxacin, diazepam, epanolol, fluconazole, and with many other more drugs, it interacts. Irregular use of codeine. So irregular use affects person's health and life. The potential for irregular use of codeine-containing medications is not only detrimental to a person's health, but has economic and social implications. The adverse consequences of codeine use and misuse are considered under 4 categories. Number 1, impairment. Number 2, injury. Number 3, has adverse health effects. And number 4, dependence. Brands of codeine. There are various brands of codeine available in market, and I have selected Brufen Plus 20 mg tablet by Abbott Laboratories Pakistan Limited, and the price for this brand is 90. Codeine Plus available as 15 mg, 500 mg, and 30 mg tablet by Fink, and the price is 90 rupees. Codeine P available as 15 mg, 500 mg tablet by popular price, and rupees is 29.70. There are various alternatives of codeine that can be taken. Number 1, non-opioid drugs. Number 2, tramadol. 3, tapentadol. 4, oxycodone. 5th, hydrocodone. And 6th, oral morphine. Case study. Mark, a 55-year-old male, presents to his regular pharmacy and requests Nurofen Plus, which is ibuprofen 200 mg and codeine 12.8 mg. to help his lower back pain. After discussing Mark's condition with him further, he advises he uses Nurofen Plus daily up to 3 times per day, but never more, to help his pain. He has been doing this for the last 2 years while he awaits lower back surgery. So, what's subjective? Age 55 years, gender male, chief complaint lower back pain, location lower back, duration 2 years, characterization persistent chronic pain, and current medication is Nurofen plus ibuprofen 200 mg and codeine 12.8 mg every 3 times a day. Assessment. Chronic pain is usually defined as pain that is present after the initial healing time has elapsed, typically for 3 months or more. However, not all cases of chronic pain start with an episode of acute tissue damage, although most episodes of acute pain resolve when the underlying injury or disease process heals. Some conditions such as inflammatory arthritis, peripheral neuropathy are characterized by ongoing disease process that may cause persistent pain. Chronic pain is complex and it involves not only what may be happening in the person's body, but also what is happening in their lives. Just as acute pain can be accompanied by anxiety, chronic pain can be associated with major changes in mood and how the person functions at home, work, with family, or in society. This multidimensional aspect of pain means that the person requires a skilled and comprehensive assessment and a multimodal approach for the treatment that does not rely on medicines alone. So referral to an authorized prescriber is necessary. Plan. It is important to build an empathetic relationship with initially seeing a person with chronic pain like Mark. Take time to fully understand all his factors that may be involved for this persistent pain and first build positive relationship with him. Chronic pain is very specific and requires referral to an authorized prescriber as it cannot be adequately treated with only medicines. So no non-drug treatments like we can say to control जो है include physiotherapy, mind-body technique, physiological techniques, occupational therapy, massage, acupuncture, exercise, lifestyle changes, and active self-care management. Dose of codeine which has been taken is 12.8 mg, not so effective in managing pain, and the usual dose for pain relief is 30 mg every 4 hours is needed. You can take codeine either before or after food, but taking after food can prevent feelings of sickness. Codeine containing medicines are not intended or helpful for the long-term treatment of chronic pain and do not provide any relief from neuropathic pain. Furthermore, inappropriate long-term use of low-dose codeine-containing medications for chronic pain is associated with health risks. These may include developing tolerance and dependence. Last note, although some general principles can be applied, each person with chronic pain should be treated differently. It is important to stress that the aim of treatment is pain management and increasing function rather than pain cure. Dependence on codeine can arise from the self-treatment of chronic pain with over-the-counter codeine-containing medicines. Substance use disorder (SUD) is a medical condition where a person has lost control over the amount of medicine they use and can continue to use them despite experiencing harm. As a pharmacist, a complete diagnosis of SUD is outside of your scope of practice and referral to an authorized prescriber is necessary for assessment. Treatment planning maybe include detox or initiation of opioid pharmacotherapy. Side effects of taking codeine include dizziness, sedation, shortness of breath, nausea, vomiting, sweating, and constipation. Thank you.